Education in the Department of Health and Human Performance, where we teach public health and exercise science courses. Back in 2016, Marymount University received a grant from the federal government to do falls prevention work throughout Northern Virginia. And when I say fall prevention work, what that means is we do a lot of what I'm doing right now, which is a lot of education and awareness. I do a lot of presentations, go to a lot of events, but we're also implementing 3 evidence-based falls prevention programs. They are called SAIL. Anybody heard of SAIL? Few people. Okay, so SAIL, Matter Balance. Who's heard of Matter Balance? A couple of people, great. And a 3rd program called Otago. And so really, when I say implementing these 3 programs, what we're doing is we're training leaders in these 3 programs, because when the grant goes away, we want these programs to be out in the community. We want people to be able to access them. We're currently on our 3rd round of funding. We've been funded, as I said, since 2016. The current grant goes through April 2027, and we'll just have to see what happens with falls prevention grant funding after that time, whether we'll still be doing this. The good news is at Marymount University, a couple years ago, we launched a Center for Optimal Aging, and so the falls prevention work that I do and some of my colleagues do will continue even after the grant ends. So again, the other part is, as Jane mentioned, Northern Virginia Falls Prevention Alliance. So that's sort of the community health coalition side of our work. We have professionals and other people who are interested in helping older adults stay safe. So what are we going to do today in a very short 15 minutes? Talk about why falls prevention is important. I'm going to share some current statistics with you. What are the major risk factors for a fall? And then most importantly, what can we do to reduce our risk of a fall? So the statistics about falls are a little bit scary, right? Falls are the leading cause of injury and injury-related death for people over the age of 65. And so you can see on this slide, over 8 million falls every year require medical attention, over 1 million hospitalizations. And this is just in the United States due to falls. The average cost of a fall for one person is around $62,000 when you add in an emergency room visit and perhaps a hospital stay, surgery, rehab, physical therapy, lost time from work, etc. And we spend in the United States over $98 billion in healthcare costs related to falls. In 2023, more than 42,000 older adults died as a result of a fall. So we share these statistics because it's important to know, and you guys all know, that's one of the reasons why you're here, is that preventing a fall is so critical, especially as we get older. People of all ages fall, right? Everybody falls. But as we get older, that risk of a serious injury increases, right? So what are some of the implications of falls? Falls can really impact our daily life, obviously, right? Increased social isolation as a result of a fall. Lost time from work, as I mentioned, when we were looking at that cost of a fall. Just reduced quality of life, reduced independence, and of course, short, long-term potential health consequences, right? You might have to take time off from work, or a friend or family member might have to take time off from work. You might have to stop doing some of the things that you like to do. So we do know that while falls are common, about 1 in 4 older adults report a fall every year. Is that all the falls? Does everybody report every fall? No, of course not. We know that. And most falls do not result in serious injury, which of course is good news. But while falls are common, right, about 1 in 4 older adults will report a fall, we do know that falls are predictable, and therefore most falls are preventable. Who believes me when I say falls are preventable? Oh, yay, my work here is done. Yay. They are, as I said, for the most part, predictable and preventable. The more I've been doing this work now for about 8 years, and the more research I read, the more articles, it really comes down to just taking a few minutes, thinking about what your own risk factors are for a fall, and modifying those that you can modify, which fortunately we can modify most of these risk factors that we're going to talk about. And falls are typically not just caused by one issue. So here's a list a family member, right? Again, some of these we can't do anything about, right? Age is a risk factor for a fall. Can we do anything about our age? Not yet. People are working on it. They're working on it, but it's not happening yet, right? So of course age is a risk factor. Having fallen previously and or a fear of falling. If you haven't had a fall, or if you're afraid of a fall, that puts you at an increased risk for another fall. Why is that? Any guesses real quick? Really changes your behavior. You might stop going out. You might stop doing some of the things that you want to do. You might stop going to that exercise class because you're afraid you're going to fall again. And so that really, your fitness level starts to decrease, and that increases your risk. Some other things, if you have a gait or balance problem, right, or any issues with the way that you walk, maybe you've had a knee replacement or a hip replacement, and so the way that you walk has changed a little bit. Postural hypotension, if you have low blood pressure from moving from a laying down position to a seated position to a standing position, we recommend that people, give yourself a few seconds for your blood pressure to sort of catch up if you have that. Decreased sensation in your feet, right? Sometimes as we get older, due to certain chronic conditions, our feet aren't as sensitive as they used to be. And you might be walking and you trip on something, but your foot didn't notice it. Your foot didn't feel that crack in the sidewalk, right? And as a result, you go down because when you're walking, right, if I trip, right, with my right foot, that message goes from my foot up to my brain, and my brain says, hurry up, left foot, go out. But if that message doesn't go, or it doesn't go quick enough, or my left leg isn't strong enough to do that, I go down, right? Certain medications can increase your risk of a fall. If you take 4 or more medications, you're at an increased risk for a fall. Also, there are certain classes of medications that by themselves can increase your risk. And so we always recommend that people check with a physician or a nurse or a pharmacist if you're starting to take a new medication, if you've had a change in dosage, or if you just don't feel right. Our bodies change as we age, right? And so that medication that you've been taking for a long time might start affecting you a little bit differently. So making sure that you let somebody know if you think your medications are making you feel differently. And also vitamin D deficiency has also been shown to increase risk of a fall. So those are things sort of internal to your person. What are some things out in the community and in your home perhaps? How many people, if you have stairs, you have hand railings on both sides of the stairs? Okay, so you should have hand railings on both sides of any sets of stairs. You always want to have one hand free for the railing. So if you do only have one railing, right, make sure that whatever you're carrying, if you're carrying something that's over here, and this hand is available for the railing. What we don't want to do is have, which I did about a year ago, have things in both hands, have socks on my feet, walking down carpeted stairs. Is a recipe for disaster, right? So always, always one hand free for the railing if you can't have both. Grab bars in your bathroom. How about a show of hands? Grab bars in the bathroom, extremely important. Most falls happen in the bathroom. Secondary to that, and third, a bedroom, hallway, and carpeted stairs. So think about getting grab bars installed. Also recommend if you're going to do that, you get a professional, somebody who is certified in home safety modifications to do that work for you, and not just your good-hearted neighbor person. And we absolutely no grab bars that use the suction cups, right? Those are dangerous. You want to get good grab bars that are installed and drilled into the studs in the wall. Poor lighting can also, of course, right? If you can't see, if you're having any sort of a vision issue or it's dark in a certain area of your room, that can also cause, increase your risk. And I always like to ask, who has clutter in their home? Oh, I have some honest people. Oh, you're going to raise 2 hands. So clutter, these things are kind of obvious, right? Trip hazards, we're moving into slippery surface season, right? Wet ground, wet leaves, even dry leaves are slippery. So thinking about, the pathways that you're taking in and around your home, Shoe choice. I always remind people, wear shoes designed for whatever it is you're doing. If you're going to go walking, walking shoes. If you're going to be out in icy or snowy conditions, boots or shoes that are designed for that weather, right? Throw rugs, also a no-no. If you have throw rugs, we recommend you dispose of them, donate them, unless you're using some double-sided sticky tape around the edges. Throw rugs are generally considered very dangerous and could increase your risk for a fall. Pets and toddlers. If you have pets or toddlers in your life, you probably already know this. They can get behind you, they can get under your feet, follow you up or down a set of stairs. So again, just sort of being aware of those if you have them. And cell phone and other distractions. How many people in here are really good at multitasking? Okay, about a third. So, unfortunately, I have bad news for you. The bad news is humans cannot multitask well. We think we can, and we want to be able to, but we can't. The human brain can really only focus on one activity at a time if you want to do it well and safely. So, I've seen people carrying groceries, they have a pet on a leash, they're on their cell phone, they're walking up a set of stairs, right? How many people in here really like to get one trip from the car into the home with your groceries? We all want to do that, right? So we load ourselves up. Again, recipe for disaster, right? Make 1 or 2 extra trips, get a few more steps in, right? For a little physical fitness. Just take 3 seconds and say, do I really think I should be carrying all of these in one trip? No. I'm going to make 2 trips. I'm going to ask somebody else to carry in a load for me, right? When we talk about falls being preventable, we really emphasize just taking 5 seconds before you're going to do something and say, should I be doing this? Or is it safe for me to do this right now? Is there someone else that could do it for me? Do I have the right shoes on? Right, just 3 seconds can prevent that fall. When we talk about prevention, we talk about these 5 factors for reducing a fall for prevention, right? Medication review. Who can do a medication review? Pharmacist, nurse, physician, healthcare provider. Once a year, having somebody review your medications, particularly, as I said earlier, if you have a new medication or a change in dosage. Right? Just making sure that you're not taking a couple things that are going to interact and cause dizziness or tiredness, or that you're not aware of all of the side effects. A gait and balance assessment. This can be done by any healthcare provider, a physical therapist, occupational therapist. There's great materials on the CDC website that can really, almost anybody can do a balance assessment on another person. There's great materials on the CDC's website. But just once a year, just having somebody make sure that you're walking properly. And that's what a physical therapist is going to have you do. They're just going to tell you, walk to the end of the room and walk back. They're just going to watch you. And they'll be able to tell if there are any issues with the way that you walk, right? Vision and hearing checks. We don't think about our senses when we think about fall prevention, but all of our senses are involved in our balance and keeping us upright. So making sure that you are getting annual vision and hearing checks. A home safety evaluation is also very important. And this can be done by, you can do it yourself. Again, materials on CDC's website. AARP has a great home safety checklist. And so it's imperative that you get your home checked. Inside, outside, stairs. Is there anything that is broken or needs to be repaired? Thresholds, moving from one room to another room. Loose carpeting. Railings that are rickety, right? Lots of different things. And you can do it yourself. Just kind of go room by room, looking for various things, cords on the floor. Anything, it might be something as simple as just rearranging your furniture could make it safer for you. Or just thinking about, I always also remind people to think about your pathway from your bed to your bathroom, right? If you have to go to the bathroom in the middle of the night, right? We're groggy perhaps. We may have taken medication to help us sleep. It's dark, we're tired. And so During that point in time, you don't want to be worried about clutter on in your floor or where you left your shoes, right? You want to be able to get to the bathroom when you need to go to the bathroom. So thinking about your pathways throughout your home and keeping them clear and safe. And then one of the most important things you can do is to maintain, improve, increase your fitness level. Last week I was in Boston at the Gerontological Society of America conference. And it's an international research conference on aging. And I can't tell you how many sessions we're talking about physical fitness and aging. I felt like I was in heaven because it's really one of my favorite topics. But people of any age and any fitness level can make improvements in their strength, their balance, and their endurance, and cardiovascular, as well as strength and endurance. Flexibility, balance, it's all kind of one concept. How many people in here exercise on a regular basis? Yay! Okay, that's a very good show of hands. So for how long do you have to exercise for? You just do it for a few weeks, maybe a year, then you're good? No, we have to exercise. We have to be fit for the rest of our life, right? And there's research on people in their 80s, 90s, over 100, who through regular and safe and appropriate exercise can improve all of those things, and it's critical. It's critical to preventing a fall. It's critical to decreasing your risk of injury if you do fall. And it also helps improve recovery if you fall. Right? All of those things are significantly impacted by your fitness level. So walking, if you're able to walk safely, is one of the best things you can do because, of course, when you walk, you're upright and you're balancing, right? And you're getting some cardiovascular endurance, but you also must be doing some strength work and some stretching, flexibility, and balance work. And these are just things you can just do, right? How many people practice standing on one leg? It's a great little exercise. You can do it anywhere in your home. Just stand, literally. You want to make sure you're near something, right? I do this in line at CVS. I do it at the grocery store. Yeah, you can be in line at CVS for a long time. So I stand on this leg for 30, stand on this leg. I make sure there's something that I can tap if I need to. I do this so many times every day. And it strengthens your leg muscles, your ankle, and improves your balance. So there are simple things that we can do to affect these things. So sort of putting this all together, strength and balance exercise, cannot emphasize that enough. Getting those regular checkups, and then making your home safer. And that might be something you can do. You might need to call in a professional. There are both for-profit and non-profit organizations that can come in and help you make your home safer so that you can be safe as you age in place, if that's what you choose to do. Finally, talking to a healthcare provider, if you feel unsteady or you feel like you have a fear of falling, it is important to talk to your friends and family about it, but also your healthcare provider about it, because there are strategies that you can employ that will help you. Why don't people want to talk to their doctor or nurse about their fear of falling? You're embarrassed? Right, or some people think it's going to perhaps cause their son or daughter or somebody to be like, oh, can't live by yourself anymore if you're afraid you're going to fall, right? But there are strategies that we can do, as we've talked about here today, to decrease that risk and make your home safer. I mentioned the CDC. They have great tools under their STEADY program. They have materials for providers, materials for community members, lots of great brochures. The National Institute on Aging also has a very good, robust section on their website on exercise and physical activity. And National Council on Aging is one of our national falls prevention resource centers. They also have a wealth of information on falls prevention. So I highly recommend those three sites for more info. And I have a couple minutes for questions, but then I do have to leave because we're getting to the end of my semester and I have to go back to Marymount and teach. Any questions, or does anybody have any comments or sort of maybe fall prevention life hacks that you've employed that you feel like keeps you a little bit safer?
I'm trying to build bone and muscle mass and also do this kind of thing, but it's overwhelming the amount of information on the internet. Where can I find like a good basic, cover all the bases workout to start with?
So I would absolutely recommend National Institute on Aging. They have good resources, and you're right, it is overwhelming. You just, you kind of just have to boil it down to something for your heart, and that could be walking, something to get your heart rate elevated, and then, you know, the exercises that sort of hit the major muscle groups, you know, lower leg, your thigh, you know, bicep, tricep, shoulder. There's 1 or 2 exercises you could do for each of the major muscle groups, and then some stretching, right? That's the bottom line. It's great if you can either, you know, a lot of people hire a personal trainer just to come for a session or 2, or maybe you can go to a community center or a fitness center and have a couple sessions with a trainer and just learn, say, hey, I want to be able to do this at my home. Can you just show me 2 or 3 exercises for each of the muscle groups that I can safely do at home? And a lot of exercise you can do just with your body weight. You don't even need extra weights. But the key is that you are doing something that is weight training, strength training, and that you very gradually increase the load of that over time. So, yes?
When you say that the cell exercise would hit all those?
Yes. So the SAIL exercise program does hit all of the things that we just talked about. The important thing to remember with SAIL is you have to increase those weights. When I teach SAIL, and I've taught SAIL since, well, for a long time, and I have some folks that have taken it many times and they're still using the same 3-pound dumbbells. And I'm like, you are not gaining fitness if you are using, have you been using 3-pound dumbbells for 5 years, right? You need to go up to 4s and then 5s, and then you can also overload by the number of reps that you're doing, right? But just it doesn't have to be anything big, but very gradually you have to increase that load over time.
How do you spell SAIL?
S-A-I-L. Yes.
Where do people find a list of sale, you know, sessions, and then also Matter of Balance?
So I would reach out to your, I'm trying to think in Alexandria, who is sort of, I don't know of any SAIL or Matter of Balance that are running in Alexandria right now. There are some in Arlington, there's some in Fairfax, there's some out in Loudoun. You know, we struggle to find instructors and we struggle to find sites for these programs, but our website, which is right here, novafallsprevention.com, you can check out that website. We have some programs listed there. You can also, through that website, send me an email. You can email me at that email, and I can try to put you in touch with anybody, any programs that are running.
Some of the rec centers have done the 2026 one will schedule come out soon.
Okay. There is a class that runs at Charles Houston, I believe. Yes.
Do you have any of these programs on videos?
No, we don't. There are some, you can find some SAIL classes on YouTube. I don't generally recommend them because can't really tell how safe they're going to be, right? So part of the problem with exercise videos is the safety issue. So that's kind of why I generally recommend get with a trainer or somebody and be taught exactly how to do the exercises, which exercises to do, is what I would generally recommend.
Where in the bathroom should the grab bars be?
Well, that's for the expert to tell you, because it depends on the shape of your bathroom. There's going to be 1 or 2 near the toilet, and there's going to be 1 or 2 or more in the shower and bath area. But it really depends on how you move in your bathroom and where your sink is and the bathroom is and this tub or shower. The expert will figure out where to place those. It also depends on your height. So yeah, that's why you want to get an expert to come and do that for you.
Do you make these presentations to other community groups?
Yes. This is my 3rd one this week. Yes.
Yes, you mentioned carpeting and stairs. So are you better to not have carpeting on your stairs?
So you can have carpeting on your stairs, you just have to think about what is on your feet when you're walking up and down the stairs. So we generally recommend that when you're inside your home, you have shoes or slippers that are have a nice, firm rubber sole. I'm not going to tell people to remove the carpet from their stairs. It really is just a matter of making sure your shoe choice is appropriate for them. In my case, socks was not good. I went kind of skiing down my stairs that day. Yes.
Yeah, I'd like to hear
curious about this issue of carpet on the stairs. I would imagine, actually, I thought about taking carpet off my stairs and putting it in hardwood, but I could just see myself skidding down the hardwood.